Tension-type headache is estimated to affect over 65 million people in the U.S., exceeding the number of those affected by migraine. It is characterized into episodic, frequent episodic, or chronic tension-type headaches, with a significant disability and resistance to medical management associated with the latter types. The pain associated with tension-type headache is commonly bilateral, is often described as a dull, band-like sensation around the frontal, temporal, and suboccipital regions of the head, and the neck may also be affected. Tension-type headaches are most commonly triggered by stress and mental tension, suggesting a mind-body-spirit connection which may be optimally treated with an osteopathic approach. Although the pathogenesis of tension-type headaches is not well understood, current theories implicate cervical myofascial trigger points, forward head posture, restrictions in cervical mobility, and referred pain as potential causes. Somatic dysfunction of the muscles of the neck or suboccipital region may contribute to headaches via tissue texture changes, restriction of motion, referred pain, and tenderness. Two osteopathic techniques that may be safe and effective in the prevention and treatment of tension-type headaches are the bilateral cervical stretch and the contralateral traction technique. The bilateral cervical stretch is a soft tissue technique performed with the patient lying supine on the treatment table. The physician sits or stands at the head of the table and places his or her hands on either side of the neck, cradling the paravertebral musculature. Tissue tension, tenderness, and cervical range of motion are assessed at the start of the technique. The finger pads should then be positioned just lateral to the spinous processes, and gentle pressure is applied first anterior and then superior with the fingers and finger pads, stretching the tissues in a longitudinal direction. Care is taken to match the tension and rate of change of the tissue. The pressure is then slowly released and the hands repositioned to a new location. All levels of the neck can be treated in this fashion with extra attention given to the areas of tightness and spasm. Tissue tension, tenderness, and cervical range of motion are then reassessed at the conclusion of the technique. The contralateral traction technique is another soft tissue technique which can be used as a complement to the prior technique or as an individual technique. The patient again lies supine on the table. Tissue tension, tenderness, and cervical range of motion are assessed at the start of the technique to determine the side of greatest restriction. The physician is facing the patient at the head of the table on the side opposite to the area to be treated. The cephalad hand is placed on the patient's forehead to gently stabilize the head. The caudad hand cradles the cervical paraspinal muscles of the contralateral side of the neck, with the finger pads placed just lateral to the spinous processes. With a gentle force, the physician pulls the tissue in a ventral fashion, exerting a stretch on the paraspinal musculature. The cephalad hand acts to stabilize the head during this procedure. This technique can be formed in a more rhythmic fashion, with the treating hand exerting a mild pull towards the physician while the stabilizing hand gently pushes the forehead away from the physician. The treating hand can be repositioned along the cervical spine musculature and the technique repeated, taking care to address the areas of particular tension or congestion. The physician can treat the other side of the neck by standing on the opposite side of the patient. Tissue tension, tenderness, and cervical range of motion are then reassessed at the conclusion of the technique. Contraindications to soft tissue OMT in the cervical region include open wounds, acute cervical fracture, cutaneous infections, local malignancy, and serious vascular compromise. In addition, direct stretching of acutely injured muscles, tendons, ligaments, or joint capsules may cause additional tissue damage or increase pain and therefore should be avoided. Tension-type headache is associated with biomechanical, psychological, and behavioral triggers, forming the basis for a multimodal treatment approach. OMT may be a useful adjuvant treatment to assist in alleviating musculoskeletal elements contributing to tension-type headache. The techniques demonstrated in this video are not intended to treat any specific clinical condition, but are only one aspect of the diagnosis and treatment plan an osteopathic physician would utilize to address the whole patient.